nasopharynx down to the oropharynx, and then down through the larynx, right? The voice box. And in the larynx is where the opening to the trachea is. And the opening consists of the two true vocal cords. That forms what we call the glottis. That's the glottis, right? Did you guys talk about this today? Okay. And through the glottis into the trachea. The trachea, more commonly referred to as the windpipe, then enters the mediastinum, through the mediastinum, and between the two lung, the right and left lung, in that space, bifurcates toward the right and left lung through the, what we call the primary bronchus. So we get that bronchial tree. Now that's really actually about 23 generations. We're going to learn the primary, secondary, tertiary, terminal, and respiratory bronchioles, okay, which lead to the alveolar ducts, which lead to alveolar sacs, that's the air pockets. And the alveolar sacs have individual pockets called alveoli, the alveoli, okay. And the alveoli is the level, the terminal air conduction level, where covering the alveoli are the pulmonary capillaries. So it's at the alveolar wall where the blood-gas interface, or the blood-air barrier, is formed. The air-blood barrier, or the blood-gas interface, and that tissue, that membrane, which is formed by the alveolar wall and the capillary wall, is called the respiratory membrane, or respiratory membrane. So once we reach that, then gaseous diffusion can take place across that membrane, oxygen in, CO2 out, as I explained earlier. Okay. Here's a cross-section through the chest wall. Of course, the cadaver, this is a view from the head down, a superior view. And the cadaver in the prone position allows us to see the right lung and the left lung and the heart, which is about 2/3 of the heart is left of the sternal midline and extends over to the left side along a 60-degree axis, and of course occupies what we're going to learn to find is called the cardiac notch of the left lung here, cardiac notch. And then, of course, see this space here? Yeah, there's a space right there, and these are ribs, of course. There's the ribs, there's the sternal body, and the ribs, of course. And then that space means there's a cavity within the thorax there where the lungs are occupied. And that's the pleural cavity. Now, the lining of the cavity itself, that is lining this tissue that I'm pointing to here, all the way around, there's a serous membrane that lines that cavity. And this should sound familiar to you. This serous membrane is the parietal pleura. It's the pleural cavity, parietal pleura. Okay? And then, from the back side, again, similar to what happened in the peritoneal cavity, around what would be in front of the thoracic vertebrae, and then covering over the surface of the lung, is the visceral pleura. Between the parietal pleura, a serous membrane, and the visceral pleura is the very tiny pleural space filled with pleural fluid. What's happening when the lungs ventilate? They expand, inflate, and deflate, and they push up against these serous membranes, and they slide across the interior of the rib cage. Slide, no pain, no dysfunction because of that pleural fluid, right? Now, if there is an inflammation and it causes a decrease in the secretion of those membranes, then the lung surface becomes dry and the lungs rub across the rib cage very painfully during ventilation. That, of course, is pleurisy. Many of you have heard pleurisy, I'm sure. Okay. So this gives us a chance to see the pleural space and where the pleural membrane would be. Okay. The upper